guys, April Green here, coming to talk to you about liposuction or liposuction, whatever you want to call it. We do two different types, vaser liposuction and just regular. The vaser is going to give a little bit more skin tightening, but Dr. Bremen will let you know which one you need. So we'll go over the items that you'll need to have at home. You'll need your prescription medications, which is going to be your antibiotic, your Cosmetic medication that we'll give you here. It's in a little box. It's already ready to go for you. You don't have to get it from your pharmacy, and it's just going to help with bruising and swelling after your surgery. There's a pre-op dose, which you'll take the night before surgery, just like that antibiotic. And then you'll take a post-op dose, so after your surgery, and then a bedtime dose. And then it's taken 3 times a day. Then you'll also have your Lovenox syringe little shots that you'll bring with you to surgery. We'll give you those so you don't have to do anything with those except bring them to your surgery. And then you'll have Phenergan for any nausea, and then your pain medicine as well. You'll also need some absorbent pads, so that can be either Johnson & Johnson Surgia dressing pads, or SurgiPad dressing pads is what they're called, or even some feminine maxi pads will work. And then at home, you'll also need some Q-tips, some hydrogen peroxide to clean your incision sites with. And then you'll need your lab work done, which you'll get your little script here to go get that done, and that's included in your cost. So before your procedure, we already talked about this in the general surgery information kind of need to know. So make sure you did go ahead and watch that video before you dive into this one. But you'll need to have all your prescription medications purchased, like I said, and ready to go. Of course, being in PO the night before, so nothing to eat or drink after midnight. Make sure you're not putting a lot of lotion on. I already talked about that in that other video, but especially for this surgery, because you'll have lots of marks on you, so we don't want that coming off. So we'll talk a little bit about the procedure. This is a body contouring procedure. It's not a weight loss procedure, so it's just made to really contour those curves that you have, bring you in. And if you do have cellulite, none of that's going to go away. That's going to stay the same, so just know that. Also know that it is extremely important to keep a stable weight after surgery. You don't want to gain any weight. And Dr. Bremen normally will tell you that he wants you, if you do plan on losing weight, he wants you to lose it before surgery rather than after. So make sure you talk to him about that. So we'll go ahead and talk about after your procedure. Like I said, you're going to restart your antibiotic and that Cosmetic medication after your surgery with a light meal. So this can mean just like some Gatorade and crackers, or if you feel able enough to eat a little bit more than that, then you can as well. You will expect a moderate amount of red colored fluid draining from your incision sites. So it kind of looks like Kool-Aid. If it's anything like straight blood that you notice coming out, a lot of it, then definitely give us a call for that. But that Kool-Aid colored fluid coming out is normal and expected. That's what those pads are for, to kind of soak that up for the first 24 to 72 hours. And those will be placed under your compression garment or your abdominal binder, whatever you want to call it, that you'll be wearing for about 2 weeks normally, but Dr. Bremen will let you know when you can get out of it. So make sure you have that on at all times unless you're laundering it or taking a shower. You're going to keep your incision sites clean by showering daily. Absolutely no hot tubs, swimming pools, baths, lakes, oceans for 4 to 6 weeks after surgery. You're going to remove your little white tape or your steri strips after about 5 days after your surgery. Sometimes these will come off beforehand just because of that fluid coming out. And if you do notice that one does come off before those 5 days, just start cleaning it with hydrogen peroxide and Q-tips. And then if all of them stay on, great. Just after those 5 days, then you'll start cleaning them. And then those little brown stitches underneath will dissolve. So you don't have to do anything with those after. You don't have to get them taken out, just clean them up. And you'll normally clean them about twice a day. Sometimes in the morning and at night is good. So you do want to avoid sitting for prolonged periods of time for about 6 weeks. So just make sure that your abdominal binder is nice and flush with your skin. You don't want it dimpling or creasing, and sometimes it will do that if you sit for a long time. It'll get that little crease, just like your little, if you have jelly rolls, then they will crease kind of. So you want to make sure that abdominal binder is staying nice and flush, and you don't want to wear any constrictive clothing that can cause your skin to fold, or like my scrubs stay in the same place pretty much all day. So I want to alternate that throughout the day, especially if they're tight. So if you can at work, just wear really loose pants and clothing. You can resume mild exercise and activity in about 4 to 7 days after surgery. Just begin slowly and gradually and increase your activity each day. Just no heavy running or weightlifting or sports or anything for about 4 to 6 weeks after your procedure. We don't want you driving for about 2 days or within 24 hours of taking your last pain pill. So if you're okay after 3 days to drive, then that's fine. Just make sure you're not taking your pain medication. So most people will return to work in about 3 to 7 days. Just expect some soreness and fatigue a little bit easier. It's not completely abnormal to run a slight fever after surgery. If you do notice that you are running a little warm, take your temperature. If it is kind of increased, drink more water. Take your pain medicine, which has Tylenol in it, but if you're not taking your pain medicine anymore, just Tylenol is fine. And if it doesn't go below 101.5 after that, then give us a call. Definitely notice or make sure you're watching your incision areas, making sure there's no signs of infection like foul smelling drainage coming from them, redness or swelling or lots of pain, and that they're getting better than making sure that they're getting better and not worse. So if they're looking good, and then they started looking kind of nasty, then definitely give us a call. You should expect some dark bruising around the liposuctioned areas and some swelling. Bruising normally goes away within 3 to 5 weeks, and swelling can persist in about 3 to 6 months, or for about 3 to 6 months. If you have a little bit of swelling in the labial area, that's normal in women, and then sometimes it's normal for the penis or scrotum to swell a little bit also if you're a gentleman. And if you notice any ridgening or hardening lumps, then definitely let Dr. Brandman know that you are noticing those, and they should go away with some massaging in about 6 to 12 weeks. It's most common in the abdominal area. Like I said, sometimes if that binder is folding, then that can happen. So just let Dr. Brandman know if you notice that, and we'll let you know when you can start massaging. If you notice any numbness in your skin, that can be common and can last for several months until that skin regenerates. You do want to avoid the sun, especially where those incision areas are, for about 6 to 12 months, because this can, one, increase your swelling if you're in the sun a lot, and it can also darken those incision sites. So you really want to stay out of the sun or wear protective clothing or sunscreen on those incision sites for about 6 to 12 months, unless you just don't care that the incisions get darker. So that's really it. I do want to mention not to apply ice packs or heating pads to the treated areas. Like I said, you might have some numbness, so you won't really know how hot or cold those items are. And make sure you remove those steri strips in 5 days and start cleaning. You can wash your garment each time you shower in just the sink. Make sure your sink's clean before you wash it, but just some laundry detergent and water is good. And then just make sure you are wearing that compressive garment at all times until Dr. Brandman tells you that you can stop, because that's really going to help with your swelling and give you the best result. So the rest of this packet has your consents in it that you're going to sign. And in the beginning, it talks about our accreditations here at the clinic and the Cosmetic medication that we give you to help with rapid recovery, and a lot of medications to avoid if you are taking any medications. So that's it, guys. We look forward to seeing you at your pre-op. Thanks.